Hello everyone, my name is Dr. Anil Kamath. I am a senior consultant surgical oncologist at Apollo Hospital, Bangalore. So let me talk to you all about how we will treat a patient of a carcinoma middle third esophagus, say a squamous carcinoma, with some lymph nodes around the tumor, say stage 3 esophageal cancer of the middle third. So probably a few decades back, this patient would have gone for upfront surgery, but the results would not have been very good. Less than 10% of patients would have been alive at the end of 5 years. Things have changed quite a bit since then. There are many trials which have come up, and nowadays all these tumors are first discussed in a multidisciplinary tumor board. There is role for medical oncologist, radiation oncologist, and surgical oncologist. So the patient invariably first goes for what we call neoadjuvant chemoradiation. So the patient receives usually 4 to 5 weeks of radiation, usually by IMRT technique. The radiation given, usually we stop at around 40 gray, short of the full dose, and along with weekly chemotherapy. The idea is to shrink the tumor to the maximum possible extent, and in certain cases the tumor totally disappears. Following this, there is a waiting period of around 4 to 5 weeks. Following 4 to 5 weeks, the patient is then taken up for surgery. Surgery too has advanced quite a bit. Now we have the robotic method where the precision of doing the esophagectomy has improved quite a bit. The planes can be seen in a magnified way. The lymph nodal clearance can be much better. The recovery period is also much smoother than before. Most of the time in the pathology report, we may see that the patient has minimal residual disease or a complete pathological response. If the patient has residual disease on the surgical specimen, a few of them may require immunotherapy in the post-operative period. This immunotherapy usually goes on for a period of 1 year. With all these development, the prognosis of what used to be a dismal disease earlier has improved quite a bit, and we are able to achieve cure in a significant number of patients. The number today stands at around 60 to 70% of the patients may achieve some long-term survival or cure. Thank you.